You are listening to the Special Needs Children podcast with Chitra Iyer. Chitra Iyer is a parent of 22-year-old Shravan Iyer who has epilepsy, cerebral palsy and autism. She is the CEO of MFA and has been helping families with life-centered planning to reach their personal financial goals. She is also a trustee of a parent support group, the Forum for Autism, which was set up almost 2 decades ago. MFA is a 16-year-old organization working in the personal finance space. They have set up a dedicated practice to help families with special needs children to plan their financial goals and invest for them. The thoughts shared here are as a result of discussions with parents, caregivers, siblings and professionals regarding the planning of a person with special needs. In this expert series podcast, Chitra is talking to Dr. Vrajesh Udani, a renowned pediatric neurologist in India. In this interview, he will be sharing insights from his 30 years of experience in the field of neurology and epilepsy with respect to children with special needs. He will be answering key questions like, when should a parent approach you or a pediatric neurologist for diagnosis? What are the precautions that a family should take to reduce the risk of a disability occurring in their child? What is epilepsy? How is it treated and how is it managed in children with special needs?
Hi, I'm Chitra Iyer and I'm very happy to welcome to this episode Dr. Vrajesh Udani. Hi, Doctor.
Hi, how are you?
Very well, Doctor. Thank you so much for coming in. Dr. Vrajesh Udani. He is a pediatric neurologist and epileptologist at Hinduja Hospital and has been associated with other hospitals for over the last 30 years. He is affiliated to the Hinduja Hospital and runs the Comprehensive Epilepsy Center as well as the Child Development Clinic. He is also affiliated to the BJ Wadia Hospital for Children in Mumbai. I have seen, we have visited you so many times with our child, with our son Shravan, and your spot-on diagnosis and the way you have helped thousands, and now it's 1 lakh plus families. It's really, we're really grateful that you have been in our lives, Doctor. Dr. Udani is also an advisor with the Forum for Autism. So without taking too much time, I'm diving straight to the first question, Doctor. What is the meaning of having a neurological problem or a neurological deficit?
Yeah, at the outset, let me thank you for allowing me to participate in your podcast. And I hope to, give some information to your listeners who I believe are mainly parents. When you say a neurological disorder, you mean something which affects the nervous system. The nervous system in general is the brain, the spinal cord, the nerves, and the muscles. And any disease or disorder which affects these areas would be classified as a neurological disorder. Usually we call the nerves and the muscles as a neuromuscular disorder, and the neurological disorder is mainly for brain and spinal cord. A neurological deficit is when you have a loss of skill, or you may be, you may always have a lost skill from the beginning because of injury or some problem with your brain or spinal cord. Like, for example, a motor deficit where you may have weakness on one side of the body or both sides of or both legs, which is called a paraparesis, or you may have a cognitive deficit, or you may have a visual deficit or hearing deficit. So that is just what exactly is a disability which a person is suffering from.
Got it, Doctor. Doctor, so when should a parent approach you or a pediatric neurologist for a diagnosis? What should alert them? What should they watch out for in their child? And, when do they get recommended? Who recommends a specialist like you usually?
So let me first tell you what kind of symptoms these neurological problems usually come with. So, for example, you may have problems like seizures, which are basically in common parlance called fits, or you may have developmental delay, in the sense your milestones which normally happen at a particular age, range of ages really, over the first few years of life. If you're not attaining them, or if you attain them, the baby has attained them and then has lost some milestones. So that kind of problem. Or it could be big head or a small head, or it could be some problems in moving a limb, a limb, half the body, maybe all four limbs, which may have come on suddenly or gradually, or it may also happen that you may have a muscle disorder, or you must have heard of muscular dystrophies. Those kind of patients come to us. Uh, then things like, you know, specific delays, not just in everything, but maybe only language and social, which happens in autism, or maybe motor delays, which are mainly seen in conditions like cerebral palsy. So there are many conditions which, sometimes are related, sometimes are independent, and they may come to us. People who refer to us, obviously, the first port of call when a baby has these symptoms is the pediatrician or the general practitioner. And, they might come to their own conclusions. And then if you cannot solve the problem, or you're not sure what's going on, they refer us or refer the babies to us. So those are our usual referral physicians or pediatricians, general physicians or pediatricians.
Yes, doctor. And we've been trying our best to get every single doctor, pediatrician to escalate and to move to specialist to you much quicker, so that there's no delay in diagnosis, right? And doctor, what would you say are the major neurological problems in children today in India?
Um, Major neurological problems. Let's see, my own practice. We see a lot of patients. Amongst them, about half have epilepsy. So patients who have seizures, who have bad seizures, who may have acute seizures. So all sorts of different types of seizures, because that's one major bulk of our practice. The other one is the developmental issues, which I mentioned. Then you may see muscle disorders like muscular dystrophies, nerve disorders. But the causes of this, what are the major issues that are involved? What are the risk factors which cause this? Would be things like, for example, perinatal brain injuries. India is a large country. There's a lot of variation in neonatal and antenatal and neonatal care. Fortunately, we have reduced our mortality in the newborn. We have also reduced our mortality in the mothers, but we really haven't done as well in the morbidity, which, or the problems which remain after a stormy newborn period. And therefore, many injuries, be it a lack of oxygen, or a lack of glucose, or a lack of, too much bilirubin, all these things which occur in the perinatal period. The perinatal period is defined as just before birth up to the first 7 days or so. That's the time when things happen, and they have unfortunately result in a prolonged problems in a child's life, which can impact the parents and the families. So that's one of the major things. The other thing which is genetic disorders. So we have, that those can cause epilepsy, those can cause developmental problems, those can cause many, many things. And genetic disorders in a country like ours is sometimes linked to consanguinity, which occurs quite frequently in many communities. So we can talk about that later, but essentially, these are some of the things which happen. Muscle disease, again, I told you, is pretty common. For example, Duchenne muscular dystrophy, spinal muscular atrophy, which again are children with special needs. They may not have cognitive issues, but they have significant motor issues. Those are the major things which we see in our practice.
Agree, doctor. Yeah. So, doctor, the next question coming to you is what is the role of a neurologist in the field of disability today? And what is the treatment that as a pediatric neurologist you do for various developmental disorders?
So let's start with our main goal is to identify the problems which are there. Sometimes you may have a child who comes to you with, say, for example, a developmental delay. So you have to find out one, whether it's something which is specific to one area or it's global. You will find out uh, why this thing has occurred and come to a definitive diagnosis, because definitive diagnosis has lots of implications, not only on treatment, on prognosis, what's going to happen in the future, or what's going to happen in the next child. So all these things are important. And the main role with a pediatric neurologist would do is to find out what exactly is going on with your child, the diagnosis. Like people come to the neurologist very often, it is in my experience, with that you give us some medicines and you give us, get us better. So they come for a clinic appointment, and the first thing they ask me is, what do you think? Can this child become okay? Or will he have what treatment can you give me and stuff like that? But the point is that you have to go in order. You have to first come to a diagnosis. So you find out what the problems are and then why the problems are. And then you can chart out what's going to happen in the future, what kind of treatments are available, etc. So, for example, in developmental disabilities, let's take the field of for the most important thing all of us knows is to identify it and then refer to the right people. For example, if you have an autistic child, you want early intervention. So you have to recognize an autistic baby as early as even 1 to 1.5 years. It is suggestions that this patient might have this disorder, autism spectrum disorder. Or if you have a problem with motor issues where there's what is called tightness in the limbs and the baby is slow, basically there's motor development, maybe he's got cerebral palsy. Or if he has different types of seizures, what type of seizure does he have? We've identified that. We will work him up for what is causing the seizures and what treatment would be best for him. So, our treatments in disability, what do I do is diagnosis, correct counseling of what exactly is going to happen to the child, what is the reason, then refer him to the right rehabilitation specialists, for example, therapists and speech, language, behavior, etc. We also treat things like comorbidities, what are called. So, for example, a child may have epilepsy, we treat that. A child may have behavior problems, we treat that. A child may have sometimes may require treatment. I mean, all behavior problems don't, but sometimes it's very severe and is interfering with therapy or something, we treat that. With other kids, we, for example, have tone problems. So they can be very tight, and there we use medications to reduce the tightness so that they can pick up their motor development a little better. And there are many things. There are many things you can do. There's surgeries also which are available, which I don't think we should go into now. But all these things are possible, but it has to be coordinated, first diagnosed and then coordinated and managed by the pediatric neurologist.
Yes, doctor. It's so important that a family reaches you well in time, because in our country where we have so many people offering so many suggestions and so many parents with just the realization or dawning that there is something amiss, the first thing they do is run to maybe all the temples around, or visit all the quacks, or visit any and every person on the street trying to sell oils, or even land up doing treatments that are absolutely not, are just not right and would never be prescribed by.
Right. So what you need to do is, when you have a problem with your baby or with your young child, you must approach somebody who's a specialist in children. And that is really the pediatrician. Many of our pediatrician colleagues are very well versed in identifying these issues early. And it's only when they can't manage or when they want a second opinion or whatever, then they would refer. So really, because we have 30,000 plus pediatricians in our country, and the number of neurologists, who are really trained and all that is about 250, 300. So it's obviously not possible for many people to reach the neurologist as fast as possible. And if it happens also that way, it's too large a number to handle.
I have seen the queues, doctor. I've seen the queues
What I
and
mean
how you
is,
have slogged.
yeah, but what I mean is that the pediatricians are basically the first port of call, and I think many of the problems can be sorted out even at that level. There are obviously those who come to the specialist.
Absolutely, doctor. It is, we have been strongly urging the pediatricians and the general practitioners that they need to guide families about how not to go off the path, and just stick to and listen to what they're saying and approach the right people and the specialists, like you said, to take the next immediate steps for their children. So, doctor, what is the difference between a disease and a disorder?
So a disease is a specific condition, something which has a particular. Say, for example, let's look at there's a condition called tuberous sclerosis. This is a genetic condition. It has a genetic signature. It causes certain specific problems. Has specific treatments, but it can also cause a lot of disorders. So it can cause autism, which is a disorder. It can cause epilepsy, which is a disorder. It can cause behavioral problems, uh, which are also a behavioral disorder. So all these things. So a disorder is something where many diseases can cause a particular disorder, and a disorder is not generally something which you treat in a sense specifically. So, for example, if you have, say, a disorder of autism, you don't treat the disorder with medications, but you treat it with therapy more than medications. Or, for example, if you have, say, a disease like a disorder like cerebral palsy, again, you many conditions can cause cerebral palsy. So, many diseases will cause a single disorder, will come under a rubric of one disorder. You understand? And therefore, it's more specific than anything else.
Yes, doctor. Understanding the difference between disorder and disease is so important because in our community, there is so much of misunderstanding and labeling, right, for a child and for the parent to deal with, especially when they're young and in the growing years.
Yes, absolutely. So if you have, any developmental disorders, one is never sure how the child will develop just by looking at his early years. So, in those situations, we make sure that, you know, uh, we look at the trajectory, we suspect things, but we make a definitive diagnosis only when we're absolutely certain. Because development generally has a lot of variation. So you may sit at 5 months or you may sit at 9 months. Both could be considered normal. So if you do not understand that and you're looking at a child baby who's come with developmental delay, you should therefore make sure that you understand that before you label anything. Similarly, in all development disorders, many signs simply child grows out of. For example, cerebral palsy. You may have many signs initial few weeks or months of life, and by 18 months everything is gone. There are many kids with suspected autism at risk. For example, we don't use the term autism spectrum disorder before 2 years or so, even maybe a little later, because you're not sure. But you say autism at risk, so you don't want to not give treatment. You want to give therapy as early as possible, even if you suspect it at the age of 1 year, which is impossible to label at that time. So, but you have to tell that there's some issues over here in language and social or whatever, and we need to work on them as early as possible. Don't wait till a label is put, and definitely don't label the child till one is absolutely sure.
Yeah, thank you, doctor, for that clarity. Doctor, what are the precautions that you would advise a family should take to reduce the risk of a disability occurring in their child?
Yeah, so this is, suppose you're a young parent and this is going to be your first kid. Okay, or let's go before that. Whom do you marry? You never, as far as possible, try and avoid marrying within your family. One of the biggest problems in India is consanguinity. It happens in certain communities in both, minority, majority, everywhere. And because genetic disorders seem to cluster in families, because people share genes and they share good genes and they share bad genes. So when there are bad genes, two bad genes come together, you may have a problem in the kid. That's why, marrying cousins or uncles and that kind of stuff should be completely avoided as far as possible. I know it's a little difficult because of cultural and religious reasons, but lots of states which have over the last many years, many communities have stopped. This can reduce the genetic burden, the burden of genetic disease. Then you go into your, after you get married and you have a kid, you're planning to have a kid. Try and plan your kids. Okay, once you plan your kids, you then make sure that you get yourself tested. You must make sure you take folate because folate is a vitamin which helps a lot of pregnant mothers avoid things, like malformations and stuff like that, which can cause neurological problems. So, there are many things you can do, vitamins, make sure you take regular antenatal visits. There are certain things in pregnancy, for example, screening for things like Down syndrome, which can cause, as you know, intellectual disability, or things like, other syndromes, which all can be done nowadays, even with a simple blood test, something called NPT. But you can also do other screening blood tests as well with the ultrasound. So you do sonography during your pregnancy at regular intervals, especially at 18-20 weeks. You do what is called an anomaly ultrasound. You do anomaly ultrasound, then you can find out most of the major disorders in your brain, heart, everywhere. And that's very important. Then finally, as you go upload this thing, you have your regular follow-ups with the gynecologist, you take your shots and everything else. And all this is regularly done. I'm not saying anything new. But what surprises me is that so many people don't go through this process. Uh, I'm not talking about the very well-educated ones, but I'm talking about whether, in smaller cities and towns and stuff like that. And the important thing is when you're born, baby is born very often. Unfortunately, the rates of C-section are going up. And very often feeding is not looked at. So, besides the feeding has to be on the first few hours. If you're a premature, almost 2 hours, within 2 hours. If you're a full term, within 6 hours. If your weight is low, you must make sure that feeding is absolutely vital and you must check the glucose at every stage. Now coming to prevention of disability in the subsequent child. So say unfortunately you have a first kid who's having a problem. There you must have a diagnosis. Is it something acquired or is it something genetic? If it is acquired, you have to just do all the things I told you during your next pregnancy. Make sure you do not good hospital for the delivery, your good gynecologist attached to a good hospital with a nice ICU, etc. in case some problem occurs. All this should be done. But suppose you have a genetic disorder and this is proven, and nowadays the field of genetics has exploded. You can almost identify almost all the genetic disorders except a few. Many of them now we know there are some genes which are inherited and which can be sort of looked at in the next pregnancy. So at 10, 12 weeks, suppose you have a gene. Say, for example, the thing I told you about the tuberous sclerosis, which is a condition gives autism, epilepsy, has skin marks and all that. You diagnose it in the first kid. The second kid can be diagnosed in the uterus by doing a little small tissue is taken at about 10 to 12 weeks. You do the test, the same test which is abnormal in the first kid. You find out, and then you have an option that you could medically terminate the pregnancy. So you don't have the same problem in the next year. And this has already happened in India. I mean, in a big way. So this is something which people should know. People should not be scared. How will my second child have this? Go to a pediatric neurologist. He'll tell you what is the risk. There are many geneticists also who give you a risk estimate. So there are lots of specialists who can now tell you once you have a diagnosis. If you don't have a diagnosis, then you have a problem because you don't know what to counsel you about.
Yes, doctor. Doctor, I'm moving on to epilepsy, which is your forte. So, what exactly is epilepsy? How is it diagnosed? How is it treated? And how is it managed in children with special needs?
First, before I talk about epilepsy, what is a seizure? So every brain is an electrical system. It works on electrical impulses and stuff like that. Very orderly, very, not at all disturbed. Sometimes, of course, all of us get disturbed, and then you can see that you can't function as well. But generally, it works very well. Now, suddenly, you have a short circuit in the electrical system, and as you know, every electrical system can have a short circuit, so that can cause a seizure. So there's a change in your clinical state, which comes on suddenly and goes away suddenly, and that is called a seizure. So it could be the most common seizure which most people are used to is the one where you shake and all that. The whole body is shaking, you're frothing, your eyes are open, you're biting your tongue, those kind of things. Everybody's seen that in movies and all that. You see sometimes it being enacted on screen as well. There are many other types of seizures. You have jerks. Just, typical one is what are called infantile spasms, which happen a lot in developmental disabilities. And these are thought to be, baby, what happens is the baby wakes up and then goes into a jerk where the head might fall backwards, upwards, and you may get a jerk of the limbs. And then it occurs in clusters. So you may have not one, not two, but 10, 15 at a time, and then the baby is fine. He may cry or she may cry at that time. So people think he's got some abdominal pain, and don't ignore this. And this is actually a terrible disorder. It's actually an acute emergency. If you recognize it in the first 1 month, in fact, the first 1 or 2 weeks, you can have a normal baby. If you don't, and the diagnosis is delayed, you may develop an autistic child in the future. So the spasms themselves are causing the autism. Then a third type of seizure may be just staring spells. We are not sure. So these are some of the things. Now, if you have recurrent seizures and they come on without, fever or some obvious cause, then you call it epilepsy. And they're different. So epilepsy is a disorder. There are many causes of epilepsy, many causes of epilepsy. And the treatment of the epilepsy will depend on what type of seizure, what is causing it, and all those things. So now the next thing is, how do you investigate these patients? So how do you manage them? So management is basically part of, you come to the neurologist, he does some tests like MRI, EEGs, blood tests. Sometimes he may go to genetics and all this thing to find out the cause. He may do a video EEG to find out what type of seizures you have and all these things. Then usually you treat it. Now, before I go on, I must make one point over here. Seizures are best diagnosed by looking at them or by hearing the parent's story or whoever has witnessed the episode. So you must be sure it's a seizure, not by the tests. The tests are done later. What you need to do is make sure that the doctor listens to the history, and the history should be given properly by the parents. Observe properly what's happening and tell the doctor. Best if you can keep your presence of mind, take out your mobile phone and get a video of the episode. So that looking at it, video is worth 1,000 words, and it dispels a lot of false notions which the doctor may get if you just describe it. So the video is the best thing. So looking at a seizure is the best way of diagnosing it. EEGs, MRIs, etc. help us, but may be normal even if you have epilepsy. So those are some of the nuances which are there in diagnosing epilepsy. Once you diagnose it, the question is, how do you treat it? And do all seizures need treatment? In developmental disabilities, kids with developmental disabilities or special needs, most of the times we probably will need treatment because the chances of recurrence are high. So, normal kids also can get epilepsy. They have, one seizure and then may not come for the next 2 years. So, you may not have to treat the patient because remember, medicines do not cure the epilepsy, they just control it. And that is why we only treat when it's absolutely necessary or when there's a very high chance of recurrence. The treatment will depend. There are many medications which are used. We have to be very careful about the side effects of medications. For example, let's take there are many drugs which can worsen behavior. And as you all know, many developmentally disabled kids have behavior problems, and this will just get worse if you use the wrong drug. You have to use, certain developmental disabilities. For example, it might make the patient drool a lot. Some of the medications. Some of the medications might make you obese. So all these things might interfere with other problems of the special needs kids. So you have to be very careful which drug you use. There are 25, 30 drugs. The right choice is the most. You have to really take a lot of variables into the decision before you make the decision of which one to use. And then finally, the parents have to, you know, keep a diary of the seizures, regular visits to the doctors, because this is seizures. I mean, the treatment goes on for years, and usually 2 years without any seizures, 2 to 4 years without any seizures, one may think of withdrawing the drugs. So, drugs are one way of treatment. The other big method is the diet. So, we have this, you must have all heard of the ketogenic diet, the modified Atkins diet, all sorts of things, which can help control seizures as well, especially the ones which are not controllable. So, you don't start that as a primary therapy. Initially, you use medications, but if the drugs are not working, and that we usually decide after 2 or 3 drugs which have failed, then we can use the diet or we can use surgery. Surgery is something which is uh, rapidly growing field in India. We do it. Many centers. There are more than 20 centers in the country which now do it in children. And though they may not be very often, they are curative operations. And sometimes in developmentally disabled kids, we may have what are called palliative, or they improve the situation, but may not be able to completely cure because children with disabilities often have multiple areas which are injured, and therefore you obviously cannot remove them all. So there are some, but there even those patients can be helped, especially if they have bad seizures. So these are things which can be done to improve the quality of life in these babies, because you have delays, special needs, and then you have this bad epilepsy. It's really terrible.
Doctor, moving on to the next question. Are multiple disabilities common in one person?
Yes, actually they are. Let's the injuries which occur at the time of birth. Very often, those kids may develop a combination of various combinations of intellectual disability, motor disability, like cerebral palsy, autism, epilepsy, visual impairment, and this visual impairment may not necessarily be from the eyes. It may be from the brain or sometimes hearing issues. So yes, unfortunately, these in India, the brain injuries are one of the most common causes of all the neurological issues, and that's why we require such good care in the acute stage of disorders. For example, neonatal seizures and all that. We really have to take extra care to prevent problems happening in that time. So they can cause multiple disabilities, unfortunately, and very often, once the epilepsy gets controlled, sometimes the other problems become more obvious and stuff like that.
Yes. Doctor, so coming to my last question to you. In your entire career span, how has India progressed, with respect to the field of neurology? How soon would you say that, the latest diagnosis techniques or new treatments arrive here? I know you are part of many research projects and you've been collaborating with many other doctors across the world. So what, according to you, is required in your field in India?
Pediatric neurology is a young field. In the sense, I think in the late 80s, early 90s, There were a few of us. Many of us were trained over here in adult neurology and pediatrics, and that's how our interest in neurology developed. And many others were trained abroad, but there were maybe a handful, 5 or 6 of us. Today there are more than 300. So the biggest change I think has happened is that you have a lot more people, uh, even though it's a tiny number compared to the population, but still it's a start. And over the next few decades, I think this will grow. Also, education for the child neurologist was not there when we had to go abroad to get educated, or maybe do it out of interest without actual formal training. Now you have a DNB, which is coming up next year, where you can actually train uh, pediatric neurologists. These are all masters in pediatric neurology. So you have training centers already started about maybe 10 years ago in Delhi and Chandigarh and all, but there are very few in the government institutions. Now in private hospitals also you can have the same thing. That's a big change. The second change is in the awareness of disorders. So I'm sure over the years the awareness amongst the pediatricians, the general physicians, general practitioners, and even the parents and families and lay public has increased exponentially. I mean, nobody, let's take the example of autism. It was, hardly ever seen or hardly ever diagnosed in the late 90s, early 90s, late 80s. And now, there's a widespread improvements in recognition of autism, even by parents when they go to social media or when they look up what's wrong with their kid, even by the primary doctors. So I think that has really improved early intervention and treatments, even though we have very far, way behind the developed countries. I think we are moving towards that. Now, what about the technologies? So if you look at, when I trained in the 80s, we used to have CT scans. Even in the US, hardly ever did MRIs. And now MR imaging has become so widespread. We have more than maybe 1,000 machines in all of India. And the latest technology, we can image what we suspect. We can look at all the brains in fine detail. We can do lots of things in the brain. For example, look at function. There's different types of imaging which has occurred. Besides imaging of the brain, the other thing is genetics. And this has exploded since 2000, last 20 years. And after 2015, after the Human Genome Project, we are one of the countries which have really, given testing of disorders in a mass sense. I mean, we are doing genetic studies at the cost of 20,000 rupees, 25,000, as low as 15,000 rupees. In foreign countries, you're paying equivalent, 1.5, 2 lakhs per test. So it becomes, and it's widely available. So it's something which everybody is doing it. There's a lot of problems with it. There's a lot of interpretation issues and all that. But it's a learning curve. It will happen over time. But it definitely seems to help. For example, as I told you, the prenatal diagnosis has become so simple now. You diagnose a kid, you get the genetic problem on a report, and you confirm it using the correct interpretation tools, and you counsel the parents. The next baby comes out normal. So that's a big change. Finally, genetics, their treatments. I mean, treatments for epilepsy, like I told you, have progressed from a few drugs like phenytoin and phenobarbital and eptoin and all those things. And now we have 25 drugs. You have the diets, and so many people are doing the diets. We're doing surgeries, like I told you, 20 centers doing surgeries in this country, in children as well. So you can improve quality of life. And this has happened remarkably over the last 30 years in India. And I think it's a big thing. What we need, we need a lot of everything I said. We need things to be easily available, pediatric neurologists, genetic tests, all that to everybody. It should not be only people who can afford, only people who live in cities. It should be for the poor man in the rural areas. Everybody should have access to this. And that's where we are way behind. I mean, if I give you a statistic, it's quite is, majority of our doctors and medical services, I would say 90-95%, are in the metropolises and the tier 1 and tier 2 cities, not in the small cities and the rural areas. Really, the small towns or the rural areas that hardly have any physicians. So that's where the problem is. That's where it will take a long time before we reach other countries' status. But that is what you need in our country, and we need, improvement in our own technologies to develop genetic treatments. For example, you must have all heard about this treatment of one of the conditions, spinal muscular atrophy, where a 16 crore injection is now available. That's $2 million, single injection to cure a genetic disease forever. How can we afford it? So most of the genetic treatments which are coming in, most of the newer drugs which are coming in are so expensive. And we cannot wait, our patients cannot wait till those become mass produced and these things happen. So it's really something which needs to be, looked at by the governments and other healthcare authorities.
Doctor, I think that what you shared last was really an eye-opener. It's amazing and great to know that, we've started training centers, but at the same time, all that you shared in terms of for the man in the village to, for all the facilities and services to be available, we still are a long, long way from there. But yes, we have hope that we have people like you who will be pushing the cause even more. So, Doctor, I learned so much from you today, and I'm sure that all the listeners understand the need and role of a pediatric neurologist and epileptologist much, much better. I just hope that those who need help from specialists like you are able to really reach you very fast. Thank you so much for your time.
Thank you again very much for inviting me to participate in your podcast.
Thanks a ton, Doctor. Thank you.
You were listening to the Special Needs Children podcast with Chitra Iyer, the CEO of MFA and a trustee with the Forum for Autism. If you find this podcast relevant and interesting, it will be great if you leave a review, share, like and subscribe. You can also let us know if there is any specific topic that you would like us to cover. Feel free to email her on chitra.iyer@myfinad.com, or you can call her on 98337 85892.